I'm excited because this is a live that you have not seen announced, but I am very much looking forward to our conversation today with both Betty and Liz. We're going to be talking about recaps from the retreat, something that came out, and we're going to be discussing about trauma-informed care and why this is important to have trauma-informed care when you're seeking things such as massage therapy and things like that. So this should be really, really good. And so as we get started and we're coming in, if everybody can just drop in the comments, say hello. Maybe you'll recognize some of them from the retreat. Liz was at the retreat as well as Betty. Betty is also a support group leader and has been very active in the Call to Peace Ministry support groups and helping train leaders. So you may recognize her from there. So tell these ladies hello and greet them. I'm so excited to hear what they have to share today. It's going to be a really good conversation. So I will go ahead. Liz, can you introduce yourself? And then we'll let Betty introduce herself.
Sure. Oh, it's so great to be here today. I am Liz Evans. I'm a mom of 6. I'm 5+ years out of surviving my own emotionally abusive marriage, and so I'm acquainted with this issue from both sides. I'm a massage therapist, fitness instructor, and I love teaching about restorative movement, primarily healing trauma through moving our bodies. So just at the last retreat, I was teaching about how to erase the board when your body's keeping the score. I've also shared at several retreats with Leslie Vernick's Conquer. So just so blessed to get to be a part of this community, y'all.
Yes, and we're grateful for you and the work that you're doing. It's so important to address the body when we're dealing with trauma. And so I'm looking forward to, we're going to be talking a little bit more about that today and how you do that. So yes, I'm glad you're here. And Betty, can you introduce yourself?
Okay, I've been involved with Call to Peace for a long time, and support groups really are my passion. Mm-hmm. And especially having support group leaders that are well-trained and well-supported. Yes. And, you know, there's a huge need for support groups. The wait list is long. Mm-hmm. But I also know that a lot of us that are a little further along and are ready to reach back and help people need to be doing that in a setting where we're well-supported. And I want to say that Call to Peace is one of those settings where you can reach back and help others, but you'll have the support you need. You won't have to go out and do it on your own.
Yes. And I love that it's material that's already written. Like, so you don't have to go and sit there and create lesson plans for these women to go through. This is material that we have been using for 6 years now, going on 6 years. Yeah. 6 years that has proven successful in being able to help women process their trauma. And I love that it gives women different options. Not everybody's called to be an advocate and walk with the women through the legal process and the legal aspects of things. But some women have a heart for mentoring one-on-one in a discipleship setting and Bible study type setting. And that's what our support groups are. So it reaches those people who want to get back, who say, hey, I don't feel called necessarily to walk with a woman one-on-one through court and the legalities of things, but I would love to be able to give back to 10, 12 women in one group and be able to help them find healing and wholeness after domestic abuse. And I just love that. And something else we're going to share is that Betty and I met in a support group, not a CTPM support group, but in a support group. That's how we met 5.5 years ago. And that support group was hugely instrumental in my healing, just to have a place to be vulnerable with other people. The way we let it, that we're informed on how to give positive feedback to one another and to uplift and build one another up. Because when you've gone through domestic abuse, you've been ripped down to shreds, and being vulnerable is so scary, because when you were vulnerable before, that was what they used to abuse you and to dominate and control you. So to be in a setting where I can be vulnerable and see people use my weaknesses or my vulnerabilities to strengthen me is hugely healing. And it has to happen to find wholeness and to be able to rebuild after trauma. And that's what our support groups do. And I love that. And it's in a safe setting. We have our support group leader that's well-trained. So Betty, will you talk a little bit more about that?
Yeah, I agree. I think I was thinking back to the group that you're talking about. And actually, it was after that group that Pam and I started doing the Call to Peace support groups on Zoom. And what that group taught me that I see carried over so much is that people need validation. They need to be heard. But for me, at some point, I needed the people in that group to say, okay, how are you going to walk forward out of this? You know, like, that's what happened to you. Now what? And to be able to walk alongside each other in that. And I see in our support groups that there will be people in the group who are just beginning to understand things, people who are trying to stay well and working hard at staying well. There'll be people who are in the divorce process, people already divorced, but the curriculum works. Yes. Because it's Bible-based. It doesn't matter where you are. And that always surprises me when I see the makeup of my support group. I'm going, oh man, how is this going to work? But the support is there and the love and the care is there. But it's, I think, because we're using scripture as the basis of each support group. And the other thing that I want to encourage people about is that each lesson stands alone, meaning if you miss a week or two, you can jump right back in. You don't have to drop out because you feel like you're so far behind and you don't have time to get caught up.
Yes. And I know that I'm not the support group expert here, but I have been in a support group for over 5 years. And I just have to say, if you're thinking about leading one or you're thinking about being in one, I think it is one of the most integral parts of your recovery. You can go to counseling, you can do somatic work, you can do EMDR, you can do all these different things. But until you get into a community, you're not really seen or known until you can see yourself and be yourself in a group of other people who've gone through what you're going through. And so our group, we're texting each other all week. We're praying for each other all week. We're meeting each other's needs. This is the church. This is the body healing the body. And it's so important. So if you're just like sitting here listening to this and you're feeling a little prick in your heart, there's a reason for it. You want to go with this. This will change your life. This will change other people's life. This is the real deal.
I agree, especially if you're feeling alone and isolated, which the majority of us do.
Mm-hmm. Oh, I love that. Monica's sharing. She says, I can testify as well. Being part of a support group has changed my life. And we hear that so many times. It's changed my life. It literally saved my life. Just the isolation. And Betty has also been a mentor to me so many times. And something I always go back to is she would listen to me for a couple hours here and there as I talked about my life. And I'm like, I don't know what to do. I was like, I feel like I'm dead and it's all dying. And I remember she looked at me on the phone and she said, Lauren, it does feel like you're dying because it is a death. It's a death to everything you've known. So it's normal to feel like this is a death and you feel like everything around you is dying because it is. But you have to walk into it, feel it to overcome and to be rebirthed. And walking into that and feeling that alone, unless you've been through that, is really scary and really hard. And you don't want to do it alone. You will run from it because it's too hard. But getting in there and feeling that, and being willing to say, yeah, this hurts, this is painful. But as I feel it, I can come out the other side whole and healed. And that's what I think is really powerful about our support groups as well.
Well, we were created to be with, and we only heal when we're with. That's the only time it happens. Yeah. So support groups.
Well, and especially because the damage occurred in relationship, then it's necessary that the healing occur in relationship too. And we know Jesus is our primary relationship, but we need people. Mm-hmm. He made us that way.
Mm-hmm. Yes. And I'm glad there is good people out there. Which is hard to believe sometimes after you've been through abuse or you've felt a lot of betrayal in your Christian community. There are really wonderful, amazing Christian people out there that will love on you and speed the hands and feet of Jesus to you. And I have definitely found that at Call to Peace Ministries myself. So
I agree.
I'm grateful for that. So I'm excited to jump in today's conversation.
Yeah, I need to finish my intro.
Oh, I'm so sorry.
That's okay, because that was the piece we needed to do. But because I am a doctorate of physical therapy. I work in an outpatient clinic setting. I've been doing it for a lot of years. And my real genuine passion, the one thing I'm most passionate about is helping people with chronic pain. Get the tools that they need to self-manage, but also to decrease the baseline of their pain so that it's not interfering with their life. and bossing them around. But that includes a lot of hands-on manual therapy. And so I'm a manual therapist as far as physical therapy goes. And the practice pattern that I use is healthy touch. And the things that we're talking about today were brought to my attention and concerned me. I mean, really concerned me and made me angry, because we are telling the ladies under our care that they need to get healthy touch. And a good way to get healthy touch is massage therapy and physical therapy, that those are places that you can get safe, healthy touch. And so that's really what we'd like to address today.
Yes, because so many times when we walk in there, very vulnerable and thinking, oh, yeah,
Sure.
look, it's safe, healthy
Mhm.
touch here. And it
Mhm.
could end up very bad when memories come out. So we're going to kind of dive into that a little bit and how that what real self-hate, safe, healthy trust looks like, and how to process it if you find yourself in a position where it's not safe and healthy. So let's see, Betty, can you tell us more about what happened during the retreat when a friend of yours went to get some therapeutic body work as part of her self-care plan for the weekend?
Yes. I'm going to read this because I've interviewed her several times and I want to get the story right. I tried to memorize it, but I kept leaving out details. So Heather, which is not her real name, was gifted a massage for Sunday evening after the Call to Peace retreat in Asheville. She told the massage therapist, I have a long drive tomorrow. I don't want to feel muscle soreness. Also, I've been at an emotionally draining retreat. If you can do something really gentle, that would be good. So the therapist suggested craniosacral therapy, explaining it as a technique with really light touch. And so Heather's reply was, I don't want to open myself up to anything weird or strange. And the therapist replied, your body will guide my hands and tell me what to do. Everyone's experience is different. You may laugh or cry or fall asleep, but you will be in full control. So the massage started at her feet and progressed upward from there. She felt herself relax. It was very gentle and did not feel invasive at all. She felt a little twinge in her right hip, a little discomfort when they got to her thoracic area. But overall, that massage was just what she had requested. When the massage therapist put her hands on Heather's head, she felt as if cold water had been poured on her scalp. And then she immediately had a flashback. Not one that she could identify as an actual event, but all of her senses were engaged. And it was very disturbing. She rolled over or sat up. She doesn't remember which one. She told the therapist what had happened. She didn't go into detail about the flashback, but she just told her that she had seen something horrible. So the therapist replied, then you need to find a massage therapist where you live that is trained in craniosacral therapy. You need more sessions. So Heather collected her things, went out to her car, and she sat there in the darkness for a while, shaking and confused. Now, I want to say she initiated this conversation with me. She sought me out and said, I need to talk to you about something. She also knows that we're having this conversation about her right now. I've got her permission to share these things.
You know, and it's just listening to that story. I don't know for all of you who are listening, for me personally, I feel angst in my body. My belly is tight. I can feel her, like the idea of her gathering her things and being discombobulated and having to try to come into the world and even have to drive after this. I can imagine how traumatic this was on so many levels for her. And I also want to speak up for the massage therapist here just a little bit. It's such a conundrum because I did my training 24 years ago, and I've been doing this for a long time, but there was hardly any mention. And you think we were dealing with pain. We're dealing with people who are, especially in my profession, they're willing to undress fully if they are unwilling to undress. They're trusting me with their whole body. And yet we didn't get training on trauma. There was no such thing as even trauma informed at that time. or like what we're going to try to do is trauma training, it was not something that anybody was talking about. And so we have this whole, I mean, we have doctors, everybody who's out there who we want to help. We have the right intention. She had the right intention with what she was doing, but she didn't have the tools to give what was needed there so that Heather could walk out the door and be like, okay, I just had this event, but I've been seen, I've been soothed, I feel safe and secure. I know there's stuff coming up, but I at least can walk out of here feeling whole instead of fractured or disintegrated.
Yes. And what do you think, Betty? Would a major friend feel safe in that room?
Well, until the unsettling experience happened, she did feel safe.
Mm-hmm.
But at the moment that she had that she sat up and she had the flashback, and it was more of a flashback than a trigger. But she broke contact with the therapist's hands, which stopped the craniosacral therapy, which stopped the flashback. But the lack of training on the massage therapist part showed up. And I want to speak to that because, like Liz said, it's not the understanding trauma and how to help a patient have a traumatic episode is not in our curriculum for most medical professionals. I even went on the American Physical Therapy Association on their website in their continuing ed courses and searched the word trauma. And the only thing came up was traumatic injuries, like traumatic knee injuries or shoulder injuries, but there was nothing about trauma-informed trauma training. And so because of that, we've got to learn as the consumer how to step into that space safely until the professional community gets better trained.
Yes. Wow.
But back to this. It could have been a growth experience for both of them, but instead, Heather was re-traumatized by the response of the therapist. What she could have done would be to come alongside by stepping in and acknowledging Heather's anxiety, by helping her to regulate her trauma response, even offering her some unhurried choices like warm blanket, a cup of water. Do you want to call a friend? But definitely make sure she's safe to drive.
Yes, and not just send her out with her things.
Go ahead.
And thinking of that too, in dealing with all types of traumas and from a thinking of this like for massage therapist, it's so important to understand that some women may have really deep trauma and you don't know what could be triggered. You don't know if they have dissociative identity disorder and parts of them could come out and they're not able to get home safely or even able to connect. And so I think it's very important, or a severe dissociation amnesia, things like that would make it unsafe for these people to be able to drive and may not be able to function correctly to call somebody. So I think that's a really good perspective, is to be able to have an emergency number nearby too, that if something does happen, especially if you know you've got a lot of trauma in your background, that something comes out, they can call somebody in the case of emergency. Because if you do have dissociation, amnesia, or DID, you will not be in a position to drive. You will probably be possibly panicking and things like that. And that can feel like a trip to the emergency room. Just my own perspective of things I've experienced. I do not have DID, but I have definitely experienced dissociation, amnesia, and panic. So that's very concerning to me.
And I think that's part of why we're coming together today, is we wanted to actually give you all some tools, and we're going to be going over those as we'll do some role plays and things where you, just like everything else, we're not victims. We can actually have some ways to be self-empowered and make a plan for, okay, this is good for me, but if I have an experience, how can I make it a safe space? So that's part of what we'll be going over today as well.
I love that. It's taking the power in our own hands. It's empowering and equipping survivors to not be victims of the situation again, and to be prepared for what could come out and what can happen. And I'm looking forward to learning myself. So let's jump on in. Are there certain modalities that would be more triggering than others, or that should be taken in smaller doses, or that people should be aware of that could cause issues?
You take
That's a
this.
question. I think that speaking from my perspective, I think that what I do would probably tend to be way more triggering than what Betty does. And she can definitely speak to the energy work side of it. But for me, the work that I do is very intimate, very close. I always get permission. I work within the boundaries of what they tell me I can do and always give them permission to change the session whenever they need to. But a lot of times just working in certain areas of the body, the belly is a place where we hold so much emotional, trash or garbage or baggage. The lungs are where we hold grief. Just asking someone to take a deep breath sometimes and asking them to do it, because this is the stress breath. But when you ask them to take a deep breath, all of a sudden their body activates in another way. You never know where these things can be lodged. So it's, Betty and I were talking about just even someone's shoulder. You would think a shoulder would not be an issue. But if you've received abuse in the shoulder, then you have no idea the memories that you could be bringing to the surface. And you've just got to be sensitive and with them in that. And there's a lot of like the craniosacral. I think Betty has a lot to say about some of those from a clinical standpoint that'll really help you guys kind of key in on this issue.
Wow, thank you.
So with physical therapy, what's a little different from massage therapy is that your first visit is an evaluation. Mm-hmm. And so, with a massage therapist, you've paid to receive body work that day. But with physical therapy, we mostly do an evaluation on the very first day. We take a real extensive patient history, and that would be a good time for you to let the therapist know that you're concerned. You don't have to lay out your whole history, even if you'll make a statement like, I'm a little anxious about receiving physical therapy. And a therapist who is attuned, who is paying attention, will take that statement and will say, what can I do to help you not be so anxious? And so kind of have those thoughts together. The other thing that I would ask a patient is, if you get triggered, how do you ground yourself? How can I help you? Because physical therapy is hands-on, and I can't avoid touching the patient that doesn't want to be touched, but we can do it in a way that they're able to receive that touch, but only if the patient is forthcoming. Go ahead, Liz.
Well, that's such a great point, because I have people who come in who will sometimes start fully clothed, like I need to be touched, but I'm going to keep my clothes on. Mm-hmm. And if I was being insensitive, which I have in the past, I would say, oh, but I can have such a much better therapeutic outcome if you'll just take this off or do that. And what my job is to really honor where they're at. Mm-hmm. And, with the craniosacral as well, I'm sure you're going to speak to that too, but I've had experiences receiving craniosacral where, because it is connecting to the breath of life, it's connecting to your craniosacral fluid that feeds every cell. It can very easily connect into your emotional, somatic integration in a way that you go to a totally different place, just like Heather in that story. So it's a mystery. We all think that we know what we're doing, but we're dealing with mystery here. Mm-hmm. And we need to honor it as mystery. You honor it as mystery within yourself, and your practitioner, if they're truly attuning to you, will honor that mystery.
I agree. My craniosacral therapy, myofascial release, these are all terms that are kind of tied in together. Somato-emotional release. I received that training in the 80s, and I've been doing it ever since. It actually started with the osteopaths, and then the physical therapist picked up on it because the osteopaths started doing meds and not doing as much manual hands-on work, but they taught it to us. And when I had this conversation with Heather, I was a little surprised that craniosacral therapy was in the toolbox of massage therapists. I wasn't aware. But My craniosacral therapy course was 2 weeks of all day, every day with probably 20 other physical therapists. And there's a piece that Liz referred to called somato-emotional release. And these are terms that I want you to know just so you can ask up front, will you be doing any craniosacral therapy and myofascial release? Now, the myofascial release is sort of like what Heather got at the very beginning, which seemed fine. But like Liz says, craniosacral therapy easily slides into somato-emotional release. And with somato-emotional release, you actually relive the trauma that happened to that physical part of your body. Now, in 1982, 83, whenever I took these courses, we had a huge discussion among the physical therapists that were there. And at that point decided we're not psychologists. And if this response begins to happen with our patients, we will change our technique and stop the response. We won't allow somato-emotional release to occur. Since then, that's changed. Everybody thinks they're an expert about everything.
Yeah, unfortunately.
And my fear of that is that being trauma informed has become a niche for professional people. My dentist advertises that he's trauma informed, but it's a marketing ploy.
Yes, it is. Yes.
But it pulls in,
like saying an apple is gluten-free.
it pulls exactly. It pulls in the most vulnerable people because we are telling each other, look for a counselor who's trauma informed, look for a doctor who's trauma informed, look for an OBGYN who's trauma informed. But the truth is that there's no standard for trauma informed. It doesn't have any true meaning right now. And so we've got to protect ourselves when we go by being able to ask the right questions. Now, back to the somato-emotional release. If you have a counselor who understands somato-emotional release and who will schedule an appointment for you after a physical therapy visit, then I will do somato-emotional release with you because the counselor's not trained to take you physically through that process, which is actually a body movement thing, but only if I know you've got the support you need. Because Liz has used the term when we've been talking first responder. The medical professionals just need to be first responders. We need to know how to help the person get back to who they are when they've been triggered versus the things that a counselor will do with them.
And the somato-emotional release, I want to make sure that we're not planting fear in anybody who's listening.
I agree.
Somato-emotional release is with the right practitioner, and not where it's just like they bring it up and then they try to shut it down and go someplace else. If they take care of you and you go to a good spot, that's great. But if they actually do the work with you, I've received it and also given somato-emotional release, and it is like EMDR. It is using the body to heal the body. It's getting out of the headspace and where your body does its own healing work. So I want to make sure that we're not planting fear by saying, oh, be careful. Know that it is a gift from the Creator.
I agree.
To supersede and move you through things in a way that you couldn't move just by trying to stay in your logic. It's a beautiful thing.
Wow. Yes, it makes me excited. I'm like, I want to go find somatic therapy and get this done and release more stuff. Excuse me. And I see a question here. Somebody's coming out. Matt Stania is always asked the question, what do you mean by trauma informed? He's found out that people define it and treat it differently. That is a good way to approach it because I know there's a lot of courses circulating on the internet too that you can become trauma informed coaches. Trauma informed requires a lot of training. And it requires very specific training. And so if you have not been through very specific training that teaches you on trauma-informed practices, you're not trauma-informed. And I'm sorry, I don't hope that's not being rude or offensive to anybody, but you're not. Like, you may be trauma informed when it comes to sexual abuse, but that doesn't mean you're trauma informed when it comes to domestic abuse. Each niche has its own trauma informed. And I mean, I wouldn't say I'm, I understand domestic violence, but and I understand sexual abuse, but that doesn't mean I'm trauma informed when it comes to any type of physical care. I'm only trauma informed in the areas that I have personally studied in. And I think that we need to be careful with that too, is if you're trauma informed in one area, it doesn't mean you're trauma informed in other areas. And what training has this person have, and not just trust, oh, I've got a certification in coaching. No, they should not be your counselor. You need an actual licensure to be trauma informed and gone through very intense training to understand that. Because I've been in therapy before where I've ended up in a panic attack and all types of stuff where you can end up in bad situations because somebody thinks they're trauma informed and they're not, and it can get really bad. And now you've got to do more therapy to undo what they tried to do. So just want to put that out there.
Yeah, and Liz and I have started using the term trauma trained instead of trauma informed. And, we really feel like God's called us to step into the professional training realm of this so that people can answer the question, how have you been trained?
Mm-hmm.
What is your training in trauma? And right now there's not much out there for the medical professional people.
I love that, trauma informed versus trauma trained. Or trauma trained, versus trauma informed. I love that. That's a good way of wording.
Well, and informed implies that I've got some information.
Mm-hmm.
But training, I think, I'm just now getting this live, is that training is also, I've been thinking about this, if you're truly trauma trained, you've also looked at your own trauma as a part of that training. You've used your own experience to be a blueprint for you to be able to then offer healing into the world, or at least attunement. So it's really important that we allow the experiences that we've had to train us. Somebody who's, when we role play here pretty soon, the bad PT is going to be somebody who's probably disassociated from their own trauma. That's why they can't deal with or show up with me in the room.
Mm. Wow.
And that's one thing that we do so well in support groups, and that we do so well in Call to Peace, and that we're called to, is move into the resistance, melt into the thing that seems really hard. That's faith. That's where we get training. That's where we heal. And so that'll be part of what we're sharing with people, is we're not going to be their mental health professional, but if they're not aware, we're at least going to bring them to the awareness of, these are things that have happened, and they've also happened to you. And this is a part of being a human being, and here's how you can show up for this person in the room.
Mm. Wow. I love that. If you've dealt with your own trauma, yes, it definitely feels very uncomfortable. If you've not done any trauma work yourself and somebody's triggered, you run from that, because it's going to trigger within you what you've not dealt with. And if you run from it, you're going to get them to run from it too very, very quickly. So I'm glad you brought that point up. That is really good. What type of tools could Heather have used to care for herself in this type of unsettling experience?
I am so glad you asked, because we created a cute little acronym, and it comes from the idea that we're going to be teaching is hold space. So we want to teach people how to, for yourself, how you can hold space for yourself out there in the world when you have these triggering things happen, or how, as a professional, we can teach you how to hold space for those who seem to be deconstructing before your eyes. So the H, I'll do the H and the O, and Betty can do the L and the D. H stands for whole aware, which is also being seen. I'm aware that I have holes, and I'm aware that you have holes. And so one of the things that if I'm walking into a situation that's new, I'm going to know myself. I'm going to know my own triggers. I'm going to know what self-care things. I'm already going to know, what do I need for self-care if I start to fall off the wagon a little bit, if I'm triggered. And also the somatic emotional connection might surprise me. But one thing I'm going to keep in mind when I'm aware of those holes is to go, okay, here's a hole, and I'm surprised by this. oh, but wait, guess what? This means that I've got to a place in my healing where I can actually deal with this now. I'm getting stronger.
Yes.
So being aware of the holes. So that's the first one, whole aware. Second is open-hearted compassion. I love the book Try Softer by Andi Kolber, I believe is her last name.
Yes.
And just the whole idea, if trying softer, be kind to yourself in your thoughts. Have compassion for yourself. Know that when you're triggered, you're probably going to go to your maladaptive coping mechanisms, which are going to be usually beating yourself up or clubbing yourself to death inside with your thoughts. Like, oh, see, I was just trying to do something good for myself, but then it fell apart because of my woundedness. Why does this always happen? That kind of thing. No, that's not allowed. Open-hearted compassion. Yeah, so that's the H and the O.
Okay. L is loving action. Learn how to ask for help. Ask for the session to change if it's creating angst or a trauma response. And if you're there and you discover that your practitioner is not trauma trained, because we're not going to show up unless we expect that they are, then you may need to use your own self-regulation techniques. So go ahead and work on learning how you respond to triggers. Just like Liz says, step toward them and be curious about your triggers, and then also be curious about what helps you self-regulate, what helps you get back to your own self of who you really are. And then D stands for direct but not dominant. So be aware that you might go into a trauma response. Remember, there's 4 F's that go with trauma: flight, freeze, fight, and fawn. Those 4 F's are.
And then there's frenetically fixing and future faking. There's so many F's. I love this one. It's probably like 20 F's.
That's true. But each of us has a tendency that is our trauma response or our trigger response. And so we need to be aware and recognize when that's happening, before we get so far gone that we can't use the tools that we have. And then set your people pleasing aside. That's difficult because when you're in a massage therapist clinic, when you're in a physical therapy clinic, when you're at a doctor's office or a dentist office, it does feel like a power over situation. It does feel like that person has authority. And that person may have more knowledge than you do, but they don't have authority over your body. They don't have authority over you. Mm-hmm. And that's important to process. And so don't be so bent on pleasing that person, that professional person with the scrubs on. Tell the truth about what you're feeling in your body, in your mind, in your spirit, so that you're giving that clinician, that body worker, the opportunity to connect with you, with what your need is, and to help you with some positive next steps, because that information is crucial. But if you're pleasing me, you're going to give me the answer that you think will make me feel good about what I've done to you. That's not helpful to either one of us.
And it's also a great practice field for if you can get to a place where you're calm enough and identify a need, that you're direct about asking for that need. But hopefully your clinician, your body worker is going to come alongside of you. If they have, even if they're not trauma trained, hopefully they'll come alongside of you and just be open to what you need, and maybe make some suggestions of, can I, like Betty said earlier, can I get you a weighted blanket? I have a recovery room over here where you could just rest for a little bit. I'll come back and check in on you. Whatever it might be, to be able to help create that space instead of, and this direct, not dominant, all of these are for the people helpers as well. So just as an example with direct, not dominant, they would provide choices, but they would not say, like Heather's practitioner said, it was the end of a long day. I give her that. But her practitioner said, okay, well, you need to find somebody and have a good night. and shuffled her out the door. You have to be willing to spend some time, even if it pushes into your other appointments, to really care for that person.
Yes.
You know, I was thinking about that this morning, and I realized in the physical therapy session, you know, if I have a patient whose blood pressure shoots up, whose O2 sats are not good, you know what I'm going to do? I'm going to take time to make sure they're safe before they leave the clinic. And this is the same thing. And so if you need extra time, just because you can't show a physical symptom, it's still valuable for you to ask and speak up. Because if the patient is short of breath and doesn't tell me, then I don't know that their O2 sats are not good. If you're feeling anxious and you don't tell me, then I don't know that you need some time in the treatment room before I open the door and escort you out.
And we have to honor and value the fact that the person's emotionally bleeding out. You know, even though the only way that there's no monitor for that except for yourself. But if you can get and accept and be honest with, I'm emotionally bleeding out right now. We just, in Western society, we've just cut that part of ourselves off and we just keep moving. So, but now it's time to heal that. It's time to feel what we're actually feeling so that we can heal through it.
Yes. Thank you for sharing that. Sorry, Betty, is there something else you want to add?
No.
Sorry, it looked like you were saying something. That's a lot of information that's been so well put together and shared. I appreciate it so much. I feel empowered myself. I'm like, oh, I'm ready to walk into a massage therapy session with this. So what does it look like in the real world when we show up as a patient or client? Can you two please role play this for us? What would it look like for Liz to visit you as a PT who is not trauma trained and lacks the skills to connect with her needs as a survivor of domestic abuse?
Okay, so I'm going to be the physical therapist and Liz is my patient. And this is our first encounter. So, hello, Liz. My name's Betty. I'm the physical therapist, and I understand you're having some back pain. Can you tell me about that?
Yeah, my back just feels locked up and tight. I can barely move without pain. I could barely walk in here. I'm sure you noticed.
So, what caused that back pain?
Well, I come from a domestic violence situation, and I've taken several. I've been pushed into walls and pushed downstairs, and well, yeah, just a lot of stuff. And I tried to go get a massage. I had some people who were helping me, but I don't know. I had some weird experiences where when they touched me, it just made me tighter, and I couldn't think. It's like I lost myself. I don't know what happened.
So I need you to stand up and let me take you through range of motion and see how much movement you've got in your back. And as we go through the different motions, just let me know if it's painful or not. And I'm going to give you some exercises that you can start working on. And then
I was so bad for you, Liz. I was like, oh boy, this is going to go really bad.
Oh, that's making my hands sweat.
Yeah, mine are too. I'm just like, oh boy. No way.
In my head, I'm like, wow, this person isn't even in the same room as I am.
That is very typical, that if your clinician is uncomfortable with what you've said, they will go to their clinical skills.
Wow. Yes.
And that gives you a clue that this is probably not a physical therapist that you want to return to.
And depending on your own attachment style, let's say that you're anxious, avoidant, what you're going to do with that is you're going to think, oh, this person isn't there for me. Or maybe I'll try. I'll just do really good. Even though this doesn't feel comfortable, I'll just work really hard to do this. Or if you're dismissive avoidant, you're going to be like, oh, this person got on my nerves, and you're just going to be angrier and angrier, and you're going to be less compliant. You're going to feel yourself doing these things that have nothing to do with the actual scenario. But you're also a person at your core who needs help with this. And you're realizing this isn't going to help. This person isn't hearing me. And I hope that each one of you will honor that feeling to go, am I actually getting what I need right now? And honor yourself, because it's very easy to push aside the pushback that's going to be happening in you when you feel like this person just totally doesn't get that I'm not comfortable.
Getting your physical therapy prescription filled is like a pharmacy. You can go to any pharmacy you want to with that physical therapy prescription, even if the prescription has a specific clinic name at the top. So just because, the doctor referred you to this particular clinic to see this particular, well, not that particular therapist, but even though that prescription, and all you do as you walk out is you say, I've decided not to schedule any more visits. I'd like a copy of my prescription, please. And then you find another PT clinic. And hopefully before long, you'll be able to ask if they're trauma trained and they'll know what you're talking about.
Yes.
And when you
So you have the freedom to make those choices.
And when you find that really good, find that.
We lost you a little bit.
You're pretty fuzzy right now. So there is no repercussion. Your doctor is not going to be disappointed with you. The therapist is not ever going to know or ever really care that you didn't return. They may be relieved that you didn't return.
Mm-hmm.
But the worst thing that you can do is decide that you're going to give it another try. Mm-hmm. Or like Liz said, that you're going to be a perfect patient so that therapist will be pleased with you.
And it's really good for you to go and look for and advocate for yourself to find somebody that is a good connection, mm-hmm. because that will be more healing for you. Don't settle.
Exactly.
So I'd like to try to find a good connection, Betty. Can you help me with that?
So we're going to flip it. Right. So, hi, Liz. I'm Betty. I'm a physical therapist, and I noticed in your chart that you've been having some back pain. Can you tell me about that?
Yeah. Well, I'm a domestic violence survivor, and I was thrown down the stairs, pushed into walls, kicked in the ribs, and I hold so much tension here. And I don't know. I went to go to some massage therapy, and I just ended up feeling so weird. I went out of my head. I don't know what that's called, but and it just made me lock up even more. Like I just can't get rid of this pain. I can barely move.
So how long has this been going on?
For about 9 months now. I just started to try to get help. I thought it would go away. I thought, well, if I can get away from this relationship, maybe that'll make it feel better. But it won't go away. So I started with the massage about a month ago, and that didn't work. So I don't know what to do.
So when did the last episode occur?
Well, I got out of the relationship about 9 months ago. I had to just leave the house with my kids and a suitcase.
Okay, so you're physically safe now?
Mm-hmm.
Okay, good. That gives us a starting point, because if you're having new injuries, that's a little different than working with the injuries that are currently there. So give me an idea of your sensitivity to touch. You mentioned the massage therapist. Was there a technique that was especially difficult for you?
Well, they started with deep tissue, and that was too much. And then it didn't seem like they knew how to do anything else. They were just lighter. It felt like they were tickling me, which I could handle that lighter touch, but it didn't feel like it was very helpful.
Okay.
So I was hoping with physical therapy that maybe you might have a little more knowledge about how to deal with what's actually going on down there. I don't know. I hope so. Tired of hurting.
Okay. The other thing I'd like to know is, if in case during a therapy session you feel some triggers or you start to feel triggered, I want you to be free to speak up. And I'm talking about when it just feels kind of weird before you've even gone into a full-blown acknowledgement of, oh yeah, I'm triggered right now. But I'd also would like for you to think about, between now and your next visit back, what can I do to help you in that situation? Okay. Now, some of it we'll have to figure out together. Like sometimes if, say I'm doing some deep tissue release on your back or I'm mobilizing the vertebra, sometimes you'll feel a response, but if I remove my hands, it would become worse versus getting lighter on my touch. So I really think it's important for us to work together on this, but I need to hear from you. The other thing that I want to do is I'll have you stay on my schedule each time. So you won't come in and have a different therapist. Is there anything else that would help you?
Well, I can't think of anything right this second. I mean, I love my weighted blanket. I wonder if I should bring my weighted
Bring it
blanket
with
and
you.
just put it on a part
Yeah.
of my body.
Bring it with you, and if we need, we'll have it.
Okay.
I'll
Time out on
also
the field. Lauren, what do you notice?
I'll also plan for you to be able to stay in the treatment room by yourself a few extra minutes when the session is over. And I'll put a do not disturb sign up so that you can get yourself collected. So if you're feeling good about us proceeding, then I'm going to go ahead and I'm going to do your evaluation. I'm not going to do any deep tissue release, but I will need to do some palpation just to feel where the muscle spasm is and to determine where the painful areas are. And I'll give you some exercises probably to start working on between now and when you come back.
Great.
You feel okay about that?
I think I'd like to give it a try. It feels good.
Good. I look forward to seeing you next time.
That made me feel good and happy after the bad situation. So thank you.
After the other one, Lauren, you looked panicky.
Yeah, I was just like, that's terrible. I felt so bad for her. Like, seriously. But wow, it left me feeling good. So, and this has all been really neat. And I love how the whole acronym gives us tools to help us show up and self-regulate and make choices about what would be good for us. So let's kind of get into a little bit here on the opposite role play. What would it be like, Betty, for you to visit Liz Evans at her studio? As a massage therapist, obviously this is very different and it's a little bit more intimate than what physical therapy is. Can you role play that for us so we know what to look for in a trauma-trained massage therapist?
So first of all, when Betty comes into my wellness center, she's going to have to fill out an intake form. And we're not as medically inclined as she is in her office, but she'll fill that out. And I'm looking for very specific cues in there so that I can then ask her questions. So I'll go ahead and ask some questions just based on my pretend intake form here. Betty, it is so good to have you here today. This is our first time working together. And so I wanted to spend a little extra time for us to connect. And I want to let you know first and foremost, I am here for you. My whole job today is for me to connect with you and what you need. This is not the Liz show. This is the Betty show. So I know there's been a lot of times you've probably been in with a doctor and where you feel like you have to do exactly what they say. My job is to connect with what your body is telling you. So if it doesn't seem like I'm getting that as I'm working with you, I'd love for you to tell me anything. It could be anything. You're never going to hurt my feelings. The only thing you're going to say to me that could hurt my feelings is that I'm ugly and my mom dresses me funny. Other than that, I need your feedback. So I'm seeing here that you have a lot of lower back pain. You've got some nerve impingement coming down. Is it sciatica, do you think? It's coming down your left leg?
Yeah, the doctor said sciatica.
Also, it says that you've been through some emotional stuff. Do you mind telling me a little bit more about that?
The emotional stuff is pretty much numbness. It's just a really dense numbness.
So would a goal of your session today be to want to try to feel a little bit more in your body?
That sounds pretty scary.
Okay, I get that. So the numbness, this isn't nerve numbness. You're feeling emotionally numb.
Yes, I've got pain. It's in my back and it's running down my leg.
Mm-hmm. Mm-hmm.
And that's the physical pain part.
Well, I'm very good at working on nerves. It's not going to feel like a normal massage. It's going to feel like I'll be doing some vibration along the nerve. We can decompress the spine. There's so many different techniques that we can do, but I want to let you know that just hearing you say that you're feeling emotional numbness, we can actually use this space for a practice field for you, so that I'm guessing maybe you haven't been able to ask for what you need. I could be totally wrong about that. But I just want to say this could be a chance for you to just slow down and breathe. And there might be a time where you want to ask me to slow down or even stop. And I could take my hands off, or I could just hold my hands still and wait till you come to a place of feeling safe. If you start to not feel safe, because sometimes I found that when I connect with someone's body, there's things that happen that have nothing to do with them. There's things that happen that have, trying to get this call to not mess up our, so there's things that happen that have nothing to do with what you're experiencing on the table. It's something that happens from the past. And if that happens, I just want you to know I'm with you.
Yeah, I hear you. So my counselor told me that I needed to get a massage, and I want to be able to go back to her and tell her I did it.
Go ahead.
I said, I just want to go back to my counselor and told her I did it.
Oh.
Because she told me I needed to. So I'm not so sure. I mean, like, do I have to bring the feelings wheel with me?
Uh-huh.
The one that helps me identify them?
Well, you don't have to have the feelings wheel here. This is a chance for you to get out of your head and into your heart and into your body. And if at any time you feel like you've had enough, then it will be enough.
Thank
It is
you.
what
I
you
really,
needed to be today.
I do
What's that?
appreciate that. I said, I appreciate that. Thank you.
You're so welcome.
Wow. I want to go get a massage by you. And if I have pain, I'm going to you, Betty.
I did go to Liz's massage studio in 2018.
Wow.
It was a wonderful experience.
That is amazing. I love the approach because I mean, I've actually been to physical therapy before for injury, and I've been massage therapy. I love your approach and how you approach that is people who have been trauma trained. I got that right? Trauma trained. Okay, said the right thing. Have been trauma trained and are able to empathize with the person as well as be able to work with their whole body, and also you're at the same time you're not working with their spirit as well and their soul as you're helping them connect, because they're all interconnected. You can't just separate body and forget the soul and spirit, and you can't separate soul and spirit and forget the body. And so
exactly.
I love that. And it just makes it encouraging too, like to be able to find a massage therapist that does this type work to help our bodies release. I've definitely done massage work in my past and have had release. I even did a pedicure and they put hot wax on my feet and I just started crying. You know what I mean? You just,
there you go.
You just felt it, and you just like everything in my body just came out. I don't even know what happened, but sometimes it's just those ways of just releasing things that are stored inside it, and it just kind of opens those things up. But being able to have a therapist appointment scheduled nearby or a safe friend that you can call and talk to is really important. Just so you're not processing things alone, because that feels very overwhelming when these things stir up and you don't have anybody to talk to about it.
Mm-hmm.
There's so many things that happen in my treatment room. I'm not sure if this happens for you, Betty, but I would assume even in your treatment room. But in my treatment room, there's just people who, the heaviness, they get a chance to unload it. And I don't have to be their mental health professional. I don't want to be. But like, I have a dear friend who just called during this, and she came into one of my fitness classes And I could tell she was down. So I started talking with her afterwards. And we've had breakthroughs in body work as well. But she told me, and she works with Call to Peace now, but she told me, he pulled a gun on me last night. And I got to be like, we people helpers get to be in that place that they talk about in James, like, blessed is the person who like reaches their hand out and pulls people off of the edge of the brink of hell, right? Like, we're out there in the real world getting to be with people in their real experiences. And if we can become aware and trained to notice it, we can also walk through it in the spirit. Like, I'd like to inspire people who are people helpers to realize the more trained you are, the more you've done your own work, the more you get to show up with them in the room in a way that can literally save their life.
Wow.
You're not the savior. You don't have to have any of the answers. You just show up and you help them to be, this is what Hold does. You help them to be seen, soothed, safe, and secure.
Right.
And if you can do that, you can be the hands and feet of the Messiah.
That is beautiful. I just want to close with that because that was
Me too.
That was so powerful. So if you're watching this today and you're like, hey, I know some massage therapists, physical therapists, please share this with them. I think this is wonderful. I'm sure we can drop some contact information for both Liz or Betty if they're wanting more information about this, and say, hey, I am a physical therapist or I'm a massage therapist, and I would love to know how to become more trauma trained so I can care for others. And if I saw one person here saying she works at a Stone and Spa and she just is having a talk about this with a massage therapist. So this gets me excited that there's more women that we can y'all are able to touch through this conversation that need this trauma trained care. So thank you so much for joining us today and for all the information. I have walked away like, wow, this just blew my mind. I have learned so much and feel empowered now to go walk into my doctor's office with tools that I need. So thank you so much for sharing this. I hope every woman that's been through abuse can watch this, just because we need it, especially when we're entering into doctor's offices or massage therapists or physical therapists. So thank you so much.
Thank you.
Thank you, Lauren, for this time.
Thank you.